Dear viewer, welcome to the user's guide for the icare tonometer. This guide is intended for all users operating or familiarizing themselves with the tonometer. The video guide should never be used as the only reference when using the tonometer. Please read the printed user's and maintenance manual carefully before operating the icare tonometer, and always use it as the primary source of information. Parts of the tonometer. First of all, it is important to recognize the parts of the icare tonometer, as they are frequently referred to later on. Display. Selector button. Measurement button. Grip. Forehead support. Forehead support adjusting wheel. Collar. Central groove. Wrist strap attachment. Battery compartment cover. Turning the tonometer on and loading the probe. Before using the icare tonometer, insert the batteries and fit the wrist strap onto the tonometer's wrist strap attachment. Start by pressing the measurement button to turn the tonometer on. Load the probe into the tonometer when the display shows Load. To load the probe, open the disposable package, place it against the collar component, and drop the single-use probe into the collar. Measurement. Before measuring, ask the patient to relax and look straight ahead at a specific point. Adjust the forehead support by turning the adjustment wheel to obtain firm support for the patient's forehead in order to obtain an accurate measurement at the right distance. Bring the tonometer near the patient's eye so that the central groove is in a horizontal position. The distance from the eye to the tip of the probe is from 4 to 8 millimeters, or 1/6 to 1/3 inch, respectively. Press the center of the measurement button lightly to perform the measurement. Be careful not to move the tonometer while measuring. After each successful measurement, you will hear a short beep. To obtain an accurate reading, 6 measurements are required. Once the 6 measurements have been performed, you will hear a slightly longer beep, and the IOP will be shown on the display. Error messages. If the measurement is performed incorrectly, the icare tonometer will always beep twice and give an error message reading, which will indicate the error. For example, if the tonometer is held too far from the eye, the probe may not reach it. This will be indicated by 2 short beeps after the measurement and an EO2 reading on the display. If the groove is not in a horizontal position and the tonometer is pointing downwards, the probe may move too fast, producing an inaccurate measurement. This error will be indicated by an EO4 reading on the display. Clear the error message by pressing the selector button once. The measurement can now be repeated. For other error message indications, please read the printed user's and maintenance manual carefully.